Good morning, everybody. Welcome to Contra Costa County. It's now been a month since the first COVID vaccine was given here, and we want to give another community update on how things are going. We've been steadily expanding our vaccine eligibility beyond frontline healthcare workers, nursing home residents and staff, and those over age 75. Earlier this week, Contra Costa County expanded vaccine eligibility to all county residents 65 and older. As of today, 36,000 shots of COVID vaccine have been given to Contra Costa County, and there are 1,000 more scheduled to get vaccinated through the county and its partners. Demand obviously is, coming up, and these safe and effective vaccines are high as far as the demand goes, and we're still building the capacity. Had an airplane go over. This is going to take some time. We're at the beginning of the biggest public health immunization campaign in history, and Contra Costa County is ready for that challenge. We ask that everyone be patient. Your turn will come, and when it is your turn, we urge you to get vaccinated. The vaccine is our return ticket to normal.
Good morning. Getting the vaccine out to those who need it is our top priority in Contra Costa Health Services. Just a month ago, we were vaccinating frontline workers at hospitals in the county. And now, just 30 days later, more than 20 vaccination sites have opened across the county, and we're opening more every day. As of the state's announcement on Wednesday, all Contra Costa residents who are 65 and over are now eligible to be vaccinated. Partnerships with organizations like Diablo Valley College, where we are today, where thousands of people have already been vaccinated, have enabled us to reach across our county. Next week, we will open another clinic site in Antioch, as well as the city of Richmond. We've also created partnerships with Safeway and Rite Aid to vaccinate eligible people as requested. We're working with fire agencies across the county so paramedics can give vaccinations to eligible people. And we're also considering hosting a mass vaccination site. As Supervisor Burgess mentioned, demand for the vaccine is high. Since we expanded eligibility to the older population above 65, we've been getting about 1,000 requests an hour on our website. We've noticed a large majority of these residents also have other providers, and we're really grateful that the providers in this region, that we operate in a region where we have providers who are really stepping up to fully partner with the county in this unprecedented effort to get everyone vaccinated. Because this is not just a county and a state or even a federal effort, this is really an effort for all of us, a maximum effort across the board. And we're really grateful by the commitment from the private partners as well as other agencies across the county to really get these vaccines out. And we need them. This effort's going to take all of us, and working together to achieve the shared goal of getting everyone vaccinated, saving lives, and really moving forward, opening our economy, opening our schools, opening our community is our top priority. Now I want to hand over to Dr. Ori Savelli, who will talk a little bit more about what we're doing.
Good morning. As we said earlier, we are quickly ramping up our efforts to vaccinate as many people as possible. We want to get shots into arms. We project that by the end of next week, the county and its partners will be giving 3,600 shots per day on average, 3 times the daily average during the first month. And a month from now, we expect to be giving 5,800 shots a day. These projections are just for the county and its partners. They don't include vaccinations that will be done by private health systems that serve most of the people living in Contra Costa. To date, nearly 72,000 doses of vaccine have been allocated to public and private health systems in Contra Costa, with another 33,000 doses on the way. I'll wait for that. As mentioned earlier, 36,000 shots have been given so far, but I want to make it clear that the county is not just sitting on those other 36,000 doses. We have scheduled thousands of people to receive those doses in the coming days and weeks. Scaling up vaccine operations is much more complex than scaling up testing operations, which we successfully did earlier in the pandemic. You need trained healthcare workers to prepare the doses and give the shots. After the shot, people need a 15-minute observation period to watch for allergic reactions. During that 15-minute observation period, people need a safe place to sit and be observed in a socially distant manner. And to cap it off, all this is being built while we're facing the largest surge of the pandemic, which is already stretching our limited resources.
Good morning. I'm so heartened to see that California and Contra Costa are prioritizing and elevating and targeting older adults over 75 years old. Folks who are older have a much greater risk of poor outcomes from COVID-19. The CDC tells us that folks who are 85 and older are dying at a rate 630 times higher than folks 18 to 29 years old. The folks that we serve at Choice in Aging, frail elders, older adults, have been living in abject fear and in isolation. The irony is not lost on us that isolation is the one thing we tell elders not to do to stay healthy and to stay safe. And here we are in this moment in time where their only option has been the thing that can be most detrimental to them. That was their only option until now. This week, Choice in Aging, in partnership with Contra Costa Health Services, I should say award-winning Contra Costa Health Services, launched our mobile vaccine clinics to fill gaps in the board and care facilities that are 6 beds and smaller. We, on Wednesday and Thursday, covered 8 of these board and care facilities, provided 127 vaccinations, and I cannot begin to tell you what it felt like after 10 months of not touching the people that we love at Choice in Aging, to touch them and to project into their bodies a solution that is going to save their lives. And not only that, but that says by showing up and doing it in their home when they can't get out and get to a clinic like here, that they are valued, that they are prioritized, and that this is a different day. We see them, we care for them, and we're here to protect them. Next week, we hope to launch into the low-income housing complexes, HUD housing complexes, complexes where low-income seniors live, and start deploying vaccinations in their complexes so they too can feel they are a priority, we care, and we are going to do what it takes to save their lives. I stand here in immense gratitude to have the opportunity this pandemic has provided in Contra Costa, unlike in other counties where Choice in Aging provides services, to have a partnership within the county where we can look at the most historically marginalized populations, prioritize them, and operationalize plans to put into place to get vaccines into arms. We'll now open it up for questions.
You want to tell me who you want the questions from, and we'll call them up?
Well, I have a question on either side.
Excellent.
My question is outreach to seniors maybe don't live in assisted living, who don't have email or phone, might not know what's going on. How do you get them
So I can start with that quickly. My name is Kim McCarl. I'm the Communications Officer for Contra Costa Health Services. That's a process that we're just beginning. So we have put out the word through our website and through our social media, and we'll be opening a phone line on Tuesday where people can call in. We have partnerships with organizations like Choice in Aging, and also we're working with we have work groups that are specifically set up to do specific outreach to these communities. So that process is just starting and will be rolling out over the next couple weeks.
You have thousands of people inquiring about getting a shot. How do you prioritize to get
Yep.
first come, first serve? Please repeat the question.
The question is, how do we prioritize who gets a shot? Is it first come, first serve? The answer to that is no. We have clear criteria laid out by the federal government, the state government, and our local ethical and equitable allocations committee. So right now we're prioritizing patients in Tier 1A, which is healthcare workers and staff of residential care facilities, and also the beginning of Phase 1B. So that's basically seniors over the age of 65 is who we're taking right now.
Let me be more specific. Certainly there's a lot of seniors over 65, and you get thousands of them calling. How do you decide who gets the vaccine? You don't have enough for all of them, right?
That's correct. We have vaccine flowing in from the state on a weekly basis. So we tend to prioritize the first group, which is those 75 and older. We expect that some of the people between age 65 and 75, it will take a little longer to get to, but we are receiving their requests, keeping them in the queue, and sending out vaccination appointment tickets as those appointments open up. And we're adding literally hundreds of appointments a day. So by the end, as I said earlier, by the end of next week, we expect to be doing 3,600 appointments a day, and that's just in the county alone. Our partners at Sutter, at Kaiser, at John Muir are also beginning. And so between all of those partners together, we hope to get to this community of elders over 65 before the end of February. So I think it will be a slow rollout that will pick up speed over the next few weeks.
Will there be enough shots for all the 75-year-olds in this county?
The question is, will there be enough vaccine for all the over 75-year-olds in this county? We estimate there's about 77,000 people in this county that are over 75. We get from the state right now, at the county side of things, about 12,000 doses a week. And our partners in Kaiser, Sutter, et cetera, also get an allocation as well. Between all of them, we do expect that we'll be able to get through most of the people who are over 75 in the next few weeks, and then proceed to those between 65 and 75. But our rate limiting step is really how much vaccine we're getting allocated to us.
So would it be safe to say that it's first come, first serve for all the 75-year-olds over at this point?
Yes, I would say that. The question is it safe to say that for people 75-year-old or over, is it first come, first serve? I would say generally yes, with the caveat that people need to be patient. You know, we have a huge demand, and often when you call or get your ticket, your appointment may not be for another week or two, but we're happy to be offering appointments. The question was about vaccine allocation from federal sources to our state, and will we have enough? We have heard some of the same reports that some of the purported stockpile is not there. We're hoping that that's not true and that we'll continue to receive an ongoing allocation so we can keep vaccinating. We have an amazing team of vaccinators, registration clerks, help desk people that are all ready to make these appointments and get these vaccines into arms. So we want the vaccine to keep flowing. We're ready for that, and we hope that will be the case. There's a lot of hope also that the manufacturing capacity across the nation of this vaccine will increase over time, and we remain hopeful for that as well. Yeah, the question was about large-scale vaccination sites. We do see large-scale vaccination sites as a part of the solution. Our current approach is to have as many partners distributing vaccine as possible, so we have a really large footprint across the county. If you look at our numbers, how much vaccine we're actually delivering, we're delivering as much or more through our distributed system than a large-scale vaccination site would deliver. But we do feel that when we have enough vaccine to be able to pull off one of those sites, we would like to do that. So it's all about supply. If I had, an extra 20,000 doses, I would arrange those in a jiffy, but I just don't have those right now.
And invite Director Roth and maybe Debbie Toth up to talk a little bit about if I can invite Director Roth and Ms. Toth up to talk a little bit about our Ethical Allocations Committee and how some of these decisions and the direction is being made in terms of how the vaccine gets distributed. Debbie Toth actually sits on that committee, and Director Roth is very involved as well. So I'll turn it over to them.
Thank you. So the question or the asked us to talk a little bit about, I think what we've been hearing is a lot of questions about really now, how do you make these decisions around who's getting the vaccine, because we're not getting enough vaccine to cover everyone currently in the eligible groups. Contra Costa Health Services we are a safety net provider. Equity is a primary driver within our system, and we know that the state's guidelines and recommendations are also really emphasize and stress equity. From the first steps of our vaccine rollout, we did in fact put together a vaccination ethical and equitable allocation committee. We're really grateful for many members of our community that have been sitting on that committee working with us. This committee meets frequently. Initially we were meeting daily. Now we meet multiple times a week to go over the and review and ensure that we're really putting in place the state guidelines and really working through how we're going to operationalize that here at the local level. So for instance, we really want to think about within the group of people who are over 65, really want to emphasize those who are 75 and over are really the top priority within that high priority group. But we're also thinking about things like where you live. We've heard a lot of discussion across the state about the Healthy Places Index, and I know that many of you are familiar with that from the blueprint for the Safer Economy that came out earlier. And there are regions within the county that we know are being burdened. We know communities of color are being burdened, and we've been working really hard to make sure that that is put as a priority, as well as some other guidelines. We actually, Debbie Toth has joined our team, and she's been working and really elevates, I think, and make sure that the county is thinking through all of these high priority populations, and really people like Debbie are making sure the community voice is heard. And so our county health system and health department has a commitment to making sure the community is engaged in that. And I want to call Debbie up, not to put her on the spot, but to kind of give a little bit of the community perspective and how the community's voice is heard in the health department. So Debbie, maybe you can, I'll hand over to you, and thank you.
All right. So just to give you some examples, some real world experience of this committee, I was asked to join this committee as we started to launch from the congregate care facilities more into 65 and older and 75 and older, because Choice in Aging serves people in the community. They had someone who was an expert on congregate living facilities heretofore, and then brought me on. They're thinking, they're proactive about who's on it, what they represent, who they represent in these conversations. So today, for example, this morning, I elevated that at the state level, they authorized veterinarians getting their vaccination and their staff getting their vaccinations. But for people with disabilities and multiple comorbidities, they were not prioritized. So imagine how that might feel to me if I have cerebral palsy and a veterinarian is more important to treat dogs than it is to treat a human with disabilities. So elevating these issues of equity, and the group listens to that. The group talks about that. The group considers that. The group looks at how many available vaccines are there? Who is really going to die from this? We have these real, concrete conversations, and this is what sets Contra Costa, to me, what sets Contra Costa Health Services apart from others, is that this all then gets incorporated into how we take what the state says that we have to do and add more nuance to that to ensure we are truly getting to those most historically marginalized and those at greatest risk. It's an incredible moment, right? It's dystopian in many, many ways, but I think that the work is being done in Contra Costa to ensure we do the best we can with what we have.
So I think essential to all of this, obviously, is supply of vaccine, right? So I'm going to ask Supervisor Chair Burgess to come back up and talk a little bit about the supply and the policy piece of that.
I've heard some of the questions, and I think really what we want to emphasize, I'm going to wait a moment. I think what we really want to emphasize is that Contra Costa County is standing up for the challenge of being able to meet the demand. What we don't know is how much and when it's going to arrive, but we're getting ready, and that the people of Contra Costa, when they're registering, they're in our system, and as soon as that supply comes in, as we can do it, we are going to provide it. And that's what we're doing. We're being proactive. We don't know what's to come, but we expect, similar to what we did with our testing, is that we get better at it as we provide those services, and we get more efficient at getting that registration done. So we're getting ahead of it so that we can meet that demand. And this is why we're here today, is to let you know, let Contra Costa know that we are getting ready, and as that supply comes in, we'll meet the demand as we can.
Any last questions? Anything we haven't covered that you all want to know about?
For those who register, if you're not over 65, but you have a comorbidity or you're an essential worker, can you register now, or do you need to wait to register?
So right now, the form on our website is specific to the groups that are currently being vaccinated. So that is 65 and older, and it's frontline healthcare workers. And so as we open up additional groups, then we add that to the website and to our form. It doesn't do any good for people who are not yet in those eligible categories to register, because we don't have vaccine and we don't have appointments for them. So we're trying to make sure that we don't overwhelm the system. As the supervisor said, we're building the infrastructure and making it as ready to go as possible as more vaccine comes in. So, any last questions? Okay. As a housekeeping item, so we have a room set up where we'll have you guys go in kind of 2 at a time to maintain some social distance, and if we can find some volunteers who are willing to have their picture taken getting their vaccines, we will bring them in to you. It might take a little time, so if you guys want to kind of negotiate amongst yourselves about who goes first, we can accommodate that, and we'll get y'all in and out as quickly as we can. So thank you for being here today. Also, I have a fact sheet on email that has some of the data that we shared and the names of the speakers. If you want me to forward that to you on email, touch base with me and I'll put you all on an email and forward that to you.